Did you know that your gums could be telling you a lot about the health of your mouth and even a lot about the health of your body? You talking about this chewing gum? No, I'm talking about these gums. One thing that dentists or hygienists do at routine checkups is something called periodontal charting. You might have seen periodontal charting or had it done to you without even realizing it, but basically it's a way for dentists and hygienists to check for any hidden signs of gum disease. So specifically, periodontal charting is a very detailed assessment of your gum health. What it involves is one, first looking at your gums and seeing how visually healthy they are. Yes, just looking at your gums can tell us a lot. Healthy gums should be more pink, they should be more firm and tightly attached to your teeth. Now the exact color might vary depending on your race, but unhealthy gums are more reddish, they look more swollen, they look more inflamed. And a major part of this perio charting is measuring the pockets in your teeth. So your gums will always have some sort of space between the actual gums and those teeth. They're not all going to be firmly attached to your teeth. And that space around your teeth is called a sulcus. So what the dentist or hygienist will use is something called a periodontal probe. This is basically like a ruler on this little tiny stick that will go into that sulcus and measure the depth of it. And they'll do this on pretty much every single surface of all your teeth. So every single tooth is gonna have 6 measurements. So for example, you'll take a tooth, you'll measure 3 measurements on the cheek side and 3 measurements on the tongue side. For the cheek side, you'll do 1 measurement on the back part of the cheek side, 1 measurement right in the middle, and then 1 measurement right in the front part of the cheek side. For the tongue side, same thing, 1 in the back, 1 in the middle, 1 in the front. Just for example, this would be called, for the cheek side, distal buccal, straight buccal, mesial buccal, and for the tongue side, it would be called distal lingual, straight lingual, and mesial lingual. And you'll do this for every single tooth in your whole mouth. And on top of just doing the measurements with this ruler, you're also gonna be checking for things like bleeding, like, are your gums bleeding? You know, when people say like, oh, like obviously my gums are gonna be bleeding because you're stabbing me with those instruments. Well, actually, we're not stabbing anybody. We're just gently measuring those gums. And healthy gums, when measuring with this, shouldn't bleed, believe it or not. But we're also checking other things. We're also checking things like gum recession, like how much have your gums pulled away from your teeth. We're also checking for any mobility, like are any of your teeth loose? We're also looking at your x-rays. We're seeing if there's any bone loss or any tartar buildup. Tartar is basically this plaque or this biofilm of bacteria that build up on your teeth that have hardened. They've turned into this calcified structure that you cannot really remove at home. You have to get it removed at a professional cleaning. Sometimes you can't even avoid getting tartar. Sometimes people are just more prone to getting it. And this is why you're supposed to go to the dentist every 6 months to get those teeth cleaned. So it might seem like it's going by really quick and the hygienist is just shouting out numbers when they're doing this perio charting, but there's a lot of different specific measurements and a lot of things that are being checked during this part. So now let's talk about those measurements. What are healthy measurements? We want them to be between 1 and 3. These are measured in millimeters. So that means the depth of that sulcus should be anywhere between 1 millimeter to 3 millimeters deep. Once you go beyond 3 millimeters, then we start to have some problems. The way I view it is between 1 and 3 is very healthy. Anywhere higher than 3, so like 4 millimeters, is going to be kind of a warning sign. This is not good. And anywhere beyond 4 millimeters, so now if you have 5 millimeters or bigger, this is when you start to get periodontal disease. So periodontal disease is a little bit different from typical gum disease. So when gum disease first starts off, it's called gingivitis. This means that this gum disease is just affecting your gums, and it means that your gums are really inflamed. In this stage, your gums are probably going to be more bleeding, they're going to be more red looking, they might be a little puffy, but luckily your pockets aren't deep. What happens when these pockets start to get deeper, like you start to get numbers 5 or 6 or even bigger, that means you're starting to get attachment loss to your teeth. So this is what happens when gum disease turns into periodontal disease. Gum disease just affects the gums, but periodontal disease affects the gums, but also the support structures of the teeth. So this means it affects the bones around the teeth and also the attachment of the gums to the teeth. And this is when you can start to get those deeper pockets and you can start to get bone loss. This is how you can start to lose bone around your teeth. And then what can happen is your gums can get receded, you can have some gum recession, and also your teeth can start to get more mobile. Your teeth can start to get more loose. This is actually the #1 cause that people end up in dentures because their teeth have gotten so loose or their gum disease has gotten so bad that their teeth end up needing to come out. And this is why these periodontal checkups are so important, because we can check for early signs of gum disease, and we can check for any early signs of deeper pockets or anything like that. So it kind of helps us create personalized treatment plans for every single patient. So let's say that your numbers are high. So let's say you haven't been to the dentist in a few years and you used to have all 3s, but now you have like all 5s and 6s. Well, now is time for something called a deep cleaning. Now, a deep cleaning is not a regular cleaning. A regular cleaning is when you clean away all that tartar and all that plaque and you keep your teeth really clean. But when you have those deeper pockets, it means that that tartar has gotten deeper underneath your gums. And that tartar just creates a whole lot of inflammation. And if this is left alone, then it's going to keep creating more inflammation, and those pockets will end up getting deeper and deeper. So a deep cleaning is when you go deeper than normal underneath your gums to clean away that tartar and make sure that those areas are really clean. This is the only way to lower that inflammation. And once this is done, then we'll do some follow-ups and make sure everything's healing fine. And typically those gums should tighten up again and those numbers should come down. Now, some of the other checks we talked about, like the gum recession or the mobility, could be from other things as well. For example, if you have a lot of teeth grinding, like if you're grinding your teeth a lot, you're more likely to have gum recession. Or you could have like a really weird bite where your teeth aren't biting evenly, and you could have a traumatic bite where you're biting on one tooth harder than the other. That tooth could end up with a lot of recession as well. So these are all some other things we're also looking at during periodontal charting. It's not just talking about the gum health anymore, it's talking about your whole bite and basically your whole mouth in general. And I also talked about before how this can relate to the rest of your body, because gum disease doesn't just stop in your mouth. Now there's a lot of relation between gum disease and systemic conditions. So things like heart disease, diabetes, even Alzheimer's are all being linked with gum disease now. And what's even scarier is the more severe your gum disease, the more severe your heart disease tends to be. The more severe your diabetes, the more severe your Alzheimer's tends to be. And people who improve their gum disease can improve a lot of their systemic conditions. So how can you keep your gums healthy? Well, obviously going to the dentist and getting those routine checkups, routine cleanings to make sure that you're staying on top of that, but also doing the stuff at home, like brushing and flossing every single day, and also doing any lifestyle changes. Your dentist, your hygienist are great resources to talk to improve things at home if there are any concerns with your mouth. And also I have a ton of content talking about different ways to keep your teeth clean and keep your gums clean. So check out some of the other videos that I've released as well. So with that being said, I hope you guys learned a little something about what exactly is done during periodontal charting. So if you were nervous or if you've had this done wondering like, what the heck just happened to me? Now you know. And as always, if you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. There's a lot of different controversy about fluoride. Some people want fluoride in their drinking water and use a fluoride toothpaste. Some people hate the idea of fluoride and they want to filter it out of their water and they don't use a fluoride toothpaste. The reason people use fluoride in their dental products is to prevent cavities. But what if you don't want to use fluoride but still want to prevent cavities? Is that